Thank you, Chairwoman Miller-Meeks and Ranking Member Brownlee, for allowing me to testify today in support of my bill, the New Mexico Rural Veterans Healthcare Access Act. Traveling across my district can take up to 9 hours, from Jal, New Mexico to Zuni Pueblo. That means that nearly 50,000 veterans who call New Mexico's 2nd District home have more difficulty accessing critical resources, including VA healthcare, which is largely contained in 2 veteran integrated service networks. However, in southern New Mexico, the lines don't work and veterans suffer. This problem has been occurring for over a decade. In fact, I started this fight as a staffer before I became a member of Congress. The current lines force veterans in Otero and Eddy counties to travel more than 4 hours to Albuquerque instead of nearby El Paso, less than an hour away, for health care. Traveling long distances for basic care, referrals, and other appointments creates an incredible hardship for those who served our country. And it's not just long distances, it's the dignity of care and extended waiting times. The VA will only provide mileage reimbursement to veterans who seek service within their VISN lines. So a veteran in Carlsbad is faced with an unjust choice: get reimbursed for a 9-hour trip to their designated VA hospital in Albuquerque, or bear the cost themselves for a 4-hour trip to El Paso. Our veterans opt for the closest VA but are not receiving any mileage reimbursement for going outside their VISN lines, defeating the purpose of this system. And I recently met with both the directors of the Albuquerque and El Paso VA healthcare systems and brought the ranking member of the Veterans Affairs Committee to listen directly to veterans about the hardships that they face. And everybody in the room agreed that the line should be changed. So as legislators, we cannot leave our rural veterans behind. The Veteran Integrated Service Networks were created to make sure veterans are organized into a system where they have access to what they need. But for the rural veterans in my district in southern New Mexico, that benefit simply does not exist. My bill, the New Mexico Rural Veteran Healthcare Access Act, would move Eddy and Otero counties in my district into Veteran Integrated Service Line 18. This change would give these veterans closer access to specialty care and mileage reimbursement for the VA hospital trips that they are already making. To the veterans of New Mexico's 2nd Congressional District, know that I'm here fighting for you, whether you're in Eddy or Otero County, Doña Ana or Bernalillo. You all deserve equal access to the benefits that you deserve. I urge support for my legislation in this committee, and I yield back. Thank you, Ms. Chairwoman.
Thank you, Representative Vasquez. I now recognize